Good evening. I'm Avanti Allen Benson, Population Health Manager with the Portsmouth Health Department. We were with you in December, and we promised that we were coming back, and we are. We promised that we would bring you more information. The last 25 months have been a challenge. Now more than ever, it's time for us to re-engage and to make health a priority. Tonight's focus is on the results of the latest community health survey completed by the City of Portsmouth. The key, as the Portsmouth Health Department applies for reaccreditation with the Public Health Accreditation Board, better known as FAB. Portsmouth is one of only 5 health departments in Virginia with this honor. Something to pat ourselves on the back. In addition, a representative from each department will give a high-level overview of the services provided. So if you have any questions, we'll give you that opportunity as well. The program is being recorded and will be available in the next couple of days on Portsmouth TV, Cox Channel 48, and Verizon Channel 39, and the City of Portsmouth Facebook page, as well as the Portsmouth Health Department Facebook page. Now we will have Ms. Sandra Johnson bring greetings from our acting health director, who is not with us this evening.
Good evening, I'm Sandra Johnson, the business manager of the health department, and I'd like to take this opportunity to share a message from the acting health director. Thank you for joining this evening as Portsmouth Health Department staff members give updates from the latest community health assessment and high-level department overviews. This data from the assessment will serve as a roadmap for the development of programs and promotions for better health outcomes. Your health department works every day to ensure everyone who lives, works, plays, studies, and worships in Portsmouth has an equal opportunity to live a healthy life. Through offered programs, work with the city, civic, business, academic, and faith partners, our goal is to improve the health of our city. Thank you for working with us to build a healthier Portsmouth. And again, that's from Dr. Salola Adekoya, who's our acting health director.
Thank you, Ms. Johnson. We indeed appreciate those kind words from Dr. Adekoya. Next, we will have Ms. Michelle Wentz, who is our epidemiologist, and she will give us our presentation on our community health survey.
So today I'm going to talk about what health looks like in Portsmouth. At the Portsmouth Health Department, it has become our mission to collect and share accurate health data so that healthcare professionals, policymakers, community groups, and residents can stay informed when developing solutions to overcome health challenges. But first, let's take a moment to think about the population of Portsmouth. There are an estimated 96,071 people who live in Portsmouth. Most of them are female, 52% are women, and 48% are male. The median age of people living in Portsmouth is 35. For the United States, it's 38, so we're just slightly younger than average. The residents of Portsmouth are 54% African American, 38% white, and 8% identify as being a different race. When we did a comprehensive community health assessment, we realized that we could find data on births and deaths, but there was limited data for Portsmouth on how many people were living with chronic disease, how many people exercise, do they get enough fruits and vegetables to eat, or do they smoke? So we set out to collect our own data, and we have conducted a community-wide health survey in 2013, 2014, 17, and lastly in 2021. We go out in the neighborhoods and we knock on doors. We use a CDC methodology and tool so we can be sure that the data we collect is accurate and reliable. Our health department has chosen to conduct a CHS using the CASPR methodology. That's short for Community Assessment for Public Health Emergency Response. CASPR is a tool designed by the CDC to collect accurate household-level information within a defined community in a rapid, cost-effective manner. When first introduced, CASPRs tended to be conducted during the response phase of a disaster, so that decision makers could receive timely and reliable information about the needs of an affected community. More recently, CASPERS have been applied pre-disaster to create a baseline understanding of a community's health status, including vulnerable populations, and assist with response planning and strategy development. So using a two-step process, 37 areas were randomly selected from all the census blocks in Portsmouth. And then within each of those census blocks, 7 households are randomly chosen. So it's a double random sampling method. Traditionally, we go out in person, knock on doors, and complete the survey in about 1 week. During the COVID pandemic, we started by mailing a survey out to the randomly identified households, but only 10% of surveys were returned. So during November and December, during a low period for COVID transmission, our team went out in person and knocked on doors to complete the survey. We used the CDC's cluster selection tool to automate the sampling, and additional GIS layers for the maps were provided from the City of Portsmouth. This is an example of a cluster map given to the field teams. Teams are instructed to start at the smiley face and continue in the direction of the arrow. To know how many houses to go to, the team would divide the total number of houses in that census block, in this case is 34, by 7, and then they would know to knock on every 4th house. The team would repeat this process as needed until 7 interviews were completed. Overall, the teams completed 217 surveys. So our survey tool was 1 page, front and back, and it was developed capturing information from 36 questions. Questions were determined in collaboration with our community partners and included information on demographics, general health status, chronic conditions, access to care, and health behaviors. The majority of questions are standardized from other national surveys like the BRFIS. Interview responses were recorded on both paper and electronically in an app. We prefer to have a paper copy in case of data corruption or hardware malfunction. So anytime we use survey data to represent the whole city's population, we look at the demographics of our survey respondents versus the entire city of Portsmouth. We want to make sure the sample is representative of the population. So our percentages of female and male participants match the city's. For race, white respondents were more overrepresented, while Black respondents slightly underrepresented. One limitation of the survey is that the respondent does need to speak English, so that can limit responses from residents where English is not their primary language. For age groups, those aged 20 to 59 were evenly represented, while those 60 and over were slightly overrepresented. The education level of our respondents has slightly higher education attainment of college graduates. So now let's get to the interesting part. What did we find out? How does general health compare in Portsmouth versus Virginia? Overall, 20% of our residents said that they would consider their health fair or poor, compared to 13% of Virginia residents. This was an increase since our last survey in 2017. On the right side of the slide is a map where we have estimated where general health is fair or poor in Portsmouth. Those areas in the darker blue colors reported higher instances of poor health. We asked residents what being healthy meant for them. For most, it meant that they had energy, could move without pain, and be in good mental health. 38% of our Portsmouth residents reported being obese, compared to 32% of Virginia residents. In addition, 10% of parents surveyed said that their child had been diagnosed as being overweight or obese by their pediatrician. Nearly half of our residents didn't get enough exercise, compared to a quarter of Virginia. Tobacco use is slightly higher, 33%, compared to 14%. Residents who have high blood pressure are higher here in Portsmouth than in Virginia, and while high blood cholesterol is similar to Virginia's at 33%. People who reported being diagnosed for cancer are slightly higher here in Portsmouth at 9%. 14% of Portsmouth residents have asthma, which is similar to Virginia residents. So next, looking at diabetes, 17% of Portsmouth residents said that they had been diagnosed with diabetes versus 11% of the Virginia population. The map to the right estimates those areas where diabetes is highest in our city. 90% reported that their diabetes was under control, and additionally another 21% of individuals reported they were diagnosed with prediabetes. So access to healthcare is important for a healthy community. 90% of our adult residents reported that they had health insurance, and 97% of parents said that their children had health insurance. When asked if they had a regular checkup in the last 12 months, 80% of adults reported they had, and 99% of parents said that their child had. Fewer residents reported a dental visit in the past 12 months. Only 67% of adults had a dental visit of any kind versus 83% of children. On the right, the lighter shaded areas in yellow reported fewer dental visits. 74% of individuals reported that they had one person who they think of as their personal doctor, and 92% of parents that their children were up to date on recommended vaccinations. Mental health is important to living a healthy lifestyle. 12% of our Portsmouth residents said that they consider their mental health to be fair or poor. The map on the right shows darker shaded areas where more residents reported poor mental health. 27% of those surveyed said that they had days in the past week where they had little interest in doing things. A similar number, 28%, said that they felt down, depressed, or hopeless. And nearly a third of residents surveyed reported feeling nervous, anxious, or on the edge, and another third were unable to control worrying in the past week. Taking a look at healthy eating behaviors and food access in Portsmouth, 61% said that they do not eat a serving of fruit every day, and half of Portsmouth residents report not eating any vegetables every day. The map on the right shows lighter shades as areas where vegetable consumption is lower. 60% said that they consume sugary drinks. When we asked about access to food, 20% reported that they were worried about running out of food before they had money to buy more, and 20% said that they had actually run out of food before they had money to buy more. Neighborhood safety is critical so that people feel safe in their homes, on their sidewalks, and for their kids to play outside. 11% of residents reported feeling unsafe in their neighborhood, and nearly a third of residents reported that violence in their neighborhood had increased in the past 3 years. The map on the right shows the darker shaded areas as areas of higher increased violence in their neighborhoods. After 2 years, the COVID-19 pandemic has left an impact on community. We asked residents how it had affected them. 17% of households reported their incomes had decreased. The map on the right shows darker shaded areas as being more affected by decreased income. And 10% of households reported that their access to food had decreased. Nearly a quarter of individuals, 22%, said their physical activity has been less than before, and 8% said they had difficulty accessing health care. And 11% said that their employment had been negatively impacted either by reduced working hours or they had suffered job loss. Next, we asked residents to list their top challenges during the COVID-19 pandemic. A third of residents said that their overall stress was higher. 28% said they had challenges getting necessary medical appointments. 27% experienced feelings of anxiety over the risk of infection. And 22% of individuals reported that they have suffered the loss of a loved one due to COVID-19. And 1 in 5 persons said that they had feelings of loneliness or isolation. The full report for the 2021 Community Health Survey with all the data, methodology, and analysis will be available on our website next week. It's just over 100 pages long and is full of great charts, maps, and graphs. Our goal is to offer the data in ways that are meaningful, useful, and easily understood. We have tables that provide percentages, estimated number of households, and confidence intervals. We have maps that use spatial analysis to estimate all the responses across areas that were not sampled. We also have developed neighborhood profiles by census tract that combine health status data, health behavior data, healthcare access, and social, economic, and physical factors within the neighborhood. Our next steps will be to work with our community partners to incorporate these data into a larger comprehensive community health assessment that will drive our improvement plans and areas to focus community efforts. I want to take a minute to acknowledge our COVID response team members who went out in the community and knocked on doors to talk to residents about their health. BJ, Alicia, Kayla, Angie K, Angie B, Lynn, and Lisa, we could not have this high quality data without you. So speaking of our COVID response team, I wanted to take a moment to say in the last 2 years, the Portsmouth Health Department has gathered a team of case investigators, contact tracers, epidemiologists who have specialized in schools, healthcare facilities, and workplaces. We have a care resource coordinator who has helped support families in isolation and quarantine by delivering food, cleaning supplies, and other needs. We have a mitigation specialist who goes on site to deliver supplies to businesses, workplaces, and testing kits to daycares. We've had a data manager to coordinate the massive amount of data generated by the pandemic. Since March 2020, Portsmouth has had over 20,000 cases reported to the health department, over 1,000 hospitalizations that were lab confirmed, and 336 deaths of loved ones and friends. This team has supported our community to reduce COVID transmission and allow residents to stay home when they needed to or safely return to work and school when it was time. This team has provided additional access to testing, vaccinations, and recommendations to keep our community safe. So lastly, I wanted to say that there are a lot of non-COVID reported diseases that the epidemiology team investigates. This is a full list of all the diseases that doctors, hospitals, and laboratories report to the health department every day. It's our job to investigate each case and interview the patient if needed. Our main goal is to help prevent the spread of disease in our community. Sometimes we do that by offering contact medication. Sometimes it may be by figuring out what food item made them sick and make sure others are not harmed. Other times it might be by detecting an outbreak and figuring out what the disease is that's making them ill and how to stop it from spreading. We may recommend enhanced mosquito control measures if we identify a disease caused by a mosquito. We do all of this to help our community stay healthy. So if you've been sick recently and the caller ID says the health department, pick up the phone and help us be disease detectives. Thank you.
Thank you, Michelle, for that very comprehensive report. That was a lot of information. And again, next week, that information will be on our website, the Portsmouth Health Department website. And we will send that information out as well or through our social media. Now, by chance, does anyone have any questions? Do we have any questions from the audience?
Yes.
Actually, if you don't mind.
I'm gonna take your spot. Well, hello, everyone. There it is. Hello, everyone.
Hello.
My name is J.R. Locke, and I'm with an organization, a company called EdLogix, which works with an organization that sponsored a program called Healthier 757. And we have been working with Avante's team and the City of Portsmouth Coalition in trying to make Portsmouth the healthiest city in the nation. And so my question is in regards to the report. I heard the young lady indicate that some of the next steps are reaching out to other community organizations. And so I just would like to ask, what is the core strategy that you guys have in place in order to try to improve the health of the citizens?
The first step is going to be to meet with our Healthy Portsmouth Coalition.
Okay, good.
We recently discussed the results and they had been waiting. So our Healthy Portsmouth Coalition, which is comprised of over 20 different organizations, faith-based communities, civic organizations, everyone plays a part in health. It doesn't necessarily have to be health related, but the key goal, if it's a business, is health. So we start with the Healthy Portsmouth Coalition and we bridge out from there.
Mm-hmm.
And we'll have focus groups. Hopefully by the end of June, first part of July, we'll have 2 focus groups. One, high-level business organizations, health organizations. Your organization will be included, and then we'll have one for the community.
Mm-hmm.
So we'll hear both voices, and we'll take those and we'll use those for our community health strategy. That will be our roadmap as to where we go to ensure our programs address all of the needs for the community.
Gotcha. Okay. Thank you.
So most definitely you will be involved. We invite the public, anyone who lives, worships, or plays in the city of Portsmouth is a part of the health of Portsmouth. So everyone is invited.
Avante, do you mind if I add that also, Mr. Locke? Be on the lookout. More information will be available and coming soon through the health department. Particularly, there's some funding opportunities that will be coming out because we're looking for partners in the community to help us reach out to those vulnerable populations. So within the next few weeks, you'll see something posted on our page and on our website Actually, we're looking to engage to create new partnerships to help us reach out to those communities.
We are always looking for new partners. We can never have enough partners, nor can we have enough volunteers. And it takes a village. So thank you. That was a great question, Mr. Locke. And thank you, Michelle, for that great presentation. Next, we will have Mr. Trefa Hines representing the Environmental Health Department. And he will give us an overview of some of the services that they provide.
Good evening, everyone. My name is Trefa Hines. I'm the technical specialist within the Environmental Health Department here in Portsmouth. Environmental health, if we were to go in a definition, we'd probably be here all night to just have a scientific definition. But what we're trying to do is to give you a simple explanation or a definition as possible. So environmental health is the relationships between humans and the environment. That is, maybe farm to table and other relationships. But the goal is simple. What is the relationship and how can we actually harness that relationship between human beings and the environment as well? Our goal is to prevent, promote, and protect. Objectives: to develop, educate, and build the community awareness. And in order for us to do that, we actually targeted 3 areas. 1, prevention, health protection, and health education. Without those aspects, we cannot be successful. It's guaranteed. Without the community participation, without education, without acts of service within the environment of how we need to protect each other and to promote healthy environment and healthy animals or livestock, we need to have such a place where that the information is garnered and actually get out to the public. And so those areas are key for us. What do? We try to make it as simple as possible. We inspect, we educate, and also we provide services. Under the inspections, we have restaurant inspection, food trucks, school cafeterias, temporary events, such like the previous one last weekends. We have Emotion coming up. Those are the temporary events that we're talking about. As an example, convenience stores that serves food. And those convenience stores, we're talking about the ones that cook from raw, not commercially processed food like your hot dogs that you're just reheating. We're talking about foods that is actually from the raw product itself, like your chicken, your pork chops, and those type of food we're talking about. Summer feeding programs, adult living and group homes, motels, hotels, swimming pools, marinas, tattoo parlors, and inspect upon request are those used by the Department of Social Services. Educate, which is a key part of our program. It's to teach not only the food managers, but the food handlers as well. We have the pool operating program here in Portsmouth. Currently, we have approximately 45 pools within the Portsmouth areas, ranging from the hotels, motels, and residents as well. And so we want persons to be aware what are the chemicals they need to use, what type of chemicals they need to use, what are the concentration levels, so that no one within the community can be affected. Services on-site, and the on-site program is now coming on stream. This is the sewage treatment program. If you're not connected to the sewage system here in Portsmouth, and let's say you have a treatment sewage system, you would have to apply through the Portsmouth Health Department, submit an application with the plans drawing. We'll do soil sampling, soil testing to actually garner what is the percolation rate of the soil and how effective that sewage treatment application would be for you and your household, and does not affect the environment as well. Rabies control. So for animal exposures, we have persons who are exposed to a bite. Depending on the animals, we just want to have those information coming into the department where we'll have our expertise our staff members will go out there to do a field visit or a site visit where we'll have all the information with animal control as well. So if there's any positive cases of rabies, we'll then take the initial steps that is required. Plan review. Plan review, it's an application for a new business. You want to open a new restaurant, you'll have to submit a plan review application, which will then go through that package with you. Upon that, if there is any issue reference to your square footage, your facility, if there is cold storage, those type of documentation that we required for you to have a safe process. Complaint investigation we have for your foodborne illnesses and your food safety concerns. Probably if you dined at a restaurant and you have any illness you want to report to the health department, you can, and we'll take it from there. It's strictly confidential. Your name would not be exposed or anything like that. This pie chart broken up basically shows our concentration effort, which is on education and food safety. And the other colors in blue, it's for your marinas and pools and reference to our inspection that is conducted within the Environmental Health Department. What we don't do, one, residential inspection for mold and mildews, sewage backup that is connected to the city, pest control, anything that is within the household, lead-based paint, drinking water samples. Those are things that we do not do within the Environmental Health Department. However, in any area, there's always interagency activities and collaboration that we can use. And so once those information is received by us, we tend to try to figure out who is the best agency that we can provide that information to any customer that calls into us. Barbershops, hair salon, massage parlors, air pollution, solid waste management, garbage dumping. Those are things that we do not do. There are other agencies that actually connects to that. So yet again, if you call the health department and make this complaint, once we receive that complaint, we tend to figure out who is the best department we can actually send you to. To achieve any target, especially when it comes to Portsmouth and an approximate population of 90,000, our small department actually zoned Portsmouth into 3 categories. And so we have those 3 zones, and our inspectors actually do our inspection within these zones. The inspectors are rotated on a biannual basis, and so that we can have fresh eyes, fresh information during the inspections, and don't get comfortable with one inspector and become complacent. And that would actually have a negative effect when it comes to food safety. So that is our number 1 priority within the Portsmouth Health Department, is to promote, prevent, and educate as well. Thank you.
Thank you, Trifa. That was a lot of information. You all are really powerful with the information. And as you stated, you can always give us a call at 757-393-8585, extension 8585. And we can answer your question, direct your call. If it's something that we don't handle, we can determine where that question needs to go, and we can assist you. Environmental health, very busy department. All of the health departments are busy, but you'll see environmental health out on the weekends, on Sundays. As Mr. Hines said, they were out at 420th Festival, and they'll be out in Umoja. So if you see us out with the Virginia Department of Health shirt on, feel free to give us a call, stop us, and ask those questions. And if it's something that we can't answer, we'll find the answer and we'll get back with you. Now, do we have any questions from the audience in regards to our environmental health department? Well, we'll move on. Next, we will have information from Ms. Sylvia Taylor, who is the supervisor of the Women, Infants, and Children WIC.
Good afternoon. It's a pleasure to be here. My name is Sylvia Taylor. I am the WIC coordinator for the Portsmouth Health Department. I've had the pleasure to work in Portsmouth for the last 25 years in different capacities, and I've worked with the Virginia Department of Health for almost 29 years. You can't do this job and not love it. I do love serving the participants here, and we're not just a food issuing program, we're also a referring program. Basically, WIC is a food supplemental nutrition education program, and so we provide food to persons in different categories. You qualify first by your category, your resident, your income, and your nutrition and medical status. So there is a process. We are federally funded. It's a federally funded grant. So just to tell you a little bit about it, the persons that will be in different categories would be pregnant women, will be women that are breastfeeding up to 1 year, women that have had a baby and they could be on up to 6 months from their delivery, infants up to the age of 1, and children up to the age of 5. And after that, then the school lunch program will pick up from there, okay? So somebody said, how do we qualify? Well, you qualify first financially. We do a financial assessment and we will obtain all household income. Often people think they don't qualify for WIC, but they'll be surprised you can make a lot more and get WIC. Not only do you qualify through your income if you're working, your pay stubs, but you can also automatically qualify what we call adjunctively by having TANF, SNAP, or any of the other social programs that will also qualify persons in the categories I've just named. So someone would say, well, what about the dads? There's nothing for the dads. Well, guess what? If the father is he still has the child. The dad can't get it, but the child and the people in the household will qualify for it. So it's not just for women, it's for the persons that have children they care for or members they care for in those categories I just mentioned. So you say, okay, I qualify financially. What next? Then we do a whole assessment. We do a nutrition assessment and we do a medical assessment. So we have a team of nutritionists. We have support for breastfeeding. We have referral sources that we send out our clients to. So we don't just give the food. We provide information, be it health or be it community information. So someone would say, so what do you get on WIC? Can you just buy anything? Well, no, our food is geared to the nutritional healthy development of the persons we just named, okay? So some of the things they can get would be milk, eggs, cheese, cereal, juice, beans and peanut butter, fruits and veggies, tuna and salmon for those that qualify, and those are persons that are having multiples or exclusively breastfeeding. So we provide those things to families that will help them supplement their food, and they may be getting from not only the food that they purchase, but food they use their SNAP benefits with. So we're a supplemental program. We just help them get over to the next step, help them with what they have already, help them to make the best out of the resources they have available to them. So someone says you are a referral agency. Yes, we are a referral agency. We make sure that if you're having mental issues or you heard Michelle mention the numbers about depression, feeling lonely, feeling insecure. Well, we're going to find someone that can help you out with that. You having issues with housing. We don't just send you, we call them for you. I do, because who knows that person even had the phone to use to call the people. So we pride ourselves on being the anchor in the community. We have a great relationship with the healthcare providers. I know you all have heard a lot of things about formula. We're working with the healthcare providers closely with that. And it's just a joy to be able to serve the citizens of Portsmouth. Thank you.
Thank you, Ms. Taylor. Ms. Taylor and her team, they love the babies. They love the parents, but they love the babies. That's one thing about the employees of the Portsmouth Health Department. there is a passion, and it shows, because not only when they're in that building, when we're out in the community, oh, Miss Sylvia, I need to go and see her. And I know it has taken a toll the last 25 months not being able to see those babies in person.
Absolutely.
But kudos, you all have been able to get the job done and you're doing that very well.
Thank
So
you.
I know the parents and the babies will be happy to come back in person. But thank you for all that you've been able to do. And sometimes on a short turnaround with things changing when COVID evolved. So thank you. I do have a question.
Yes, ma'am.
Now, we see the babies. Do you all keep track of the children how many children have you dealt with in the last 29 years?
Let me get back with you on that. We are seeing people virtually as well over the phone, so we haven't stopped. I can't tell you how many. Some of them are parents themselves now, and I'm helping them with their children. So
Well, that's awesome. Keep up the good work.
thank you.
Do we have any questions from our audience? And if you know of someone in your community who may need these services, don't take it for granted. Share the knowledge. You never know who you may be able to help. Someone at your church, one of your neighbors. Don't assume. It's always good to ask. If you don't qualify, that's fine, but you never know. You may qualify.
Absolutely.
So again, reach out to the health department, 757-393-8585. Give us a call.
Thank you.
Next, I'm sorry, were you going to say something?
Thank you.
Oh, you're welcome. We're going to have Miss Joanna Liston, and she's going to give us a list of the community services that are offered.
Thank you, Avanti. My name's Joanna Liston, and I'm a public health nurse at the Portsmouth Health Department with the community team. There are multiple different programs that we do on the community team. The first one is the baby care program. That's a home visiting program for pregnant women and newborns up to 2 years old. This is a Medicaid eligible program, but we do accept clients that have private insurance or no insurance at all. That's on a case-by-case basis. We also have the Safe Sleep Pack and Play class and the Car Safety Seat class. With the Pack and Play class, clients are scheduled to come in for classes. When they come in, they're educated on best practices for safe sleep in their infant and provided with a pack and play so that they have a place to safe sleep their infant. With the car seat program, when they come in for that, they're educated on how to install the car seat properly, on what the laws are in Virginia for car seat safety, and then they're educated and demonstrated on how to put those car seats in. Both of those programs are Medicaid eligible if they're part of the WIC program or income requirements are met. We also have an elevated lead level program. With this program, we're notified through the laboratories or from the physicians when a child has an elevated lead level. Then we would go out and provide case management to the family. With that, we educate them on how to decrease those exposures and provide them with supplies when they're available. We also have the long-term care screening program that works in partnership with the Department of Social Service, and they screen applicants for long-term waivers for nursing facility placement. Our TB control program provides case management to clients that are positive for tuberculosis. They're educated on tuberculosis and the importance of taking medication and follow-up. Any infectious diseases, including tuberculosis, foodborne disease outbreaks, or rabies exposures, are investigated with members of our community team in conjunction with the epidemiology personnel. Okay, thank you.
All right, thank you, Miss Joanna. Again, there are a lot of services that are offered. Now, the good thing about this program, it's being recorded. You will have a chance to watch it again. If you have questions, please submit those questions. We can get your answers to you, get you the services that you need. I wish someone had a child seat class 30 years ago. That was a challenge. Ask my parents. But those resources are available. And a lot of people don't know that we know that you have to have a child seat and a car seat to bring that baby home. But do you know how to install it properly? So thank you. Thank you for all that you do. Are there any questions? Well, make sure you're referring your friends, your neighbors, again, your church members, daycare centers. Let them all know of the services that we provide. Next, we will have a presentation from Ms. Ebony Fleming, who is our nurse supervisor for our clinic services.
Good evening. My name is Ebony Fleming, and I am the clinic nursing supervisor for the Portsmouth Health Department. I will review various programs and services that we offer in our clinic. We have immunizations where we offer routine immunizations for adults and for children. We do COVID-19 vaccinations for all age groups, and we also provide travel immunizations for those traveling internationally. Many people call and inquire if we do yellow fever, international travelers about yellow fever vaccine, and we do provide that as well. We have a family planning program where we provide contraceptive methods to our patients. We do a broad range of contraceptives. We have oral contraceptives, intrauterine devices or IUDs. We do implants. We do the patch, the pill, Depo-Provera, pretty much anything that most people are looking for, we are able to provide. And we also do emergency contraceptive options as well. We give away free condoms to the public. If you come in, we have them available at the front desk. You don't have to be seen in order to receive those. And then we also offer annual women exams with pap smears, breast exams, and we do referrals for follow-up if needed. And we do pregnancy testing, referrals, and options for pregnancy. We have a sexually transmitted infection clinic or STD clinic where we do routine STD screening, treatment, and referrals. And it's your routine STI screening, gonorrhea, chlamydia, HIV, syphilis, trichomonas, hepatitis, and HSV. And we offer pre-exposure prophylaxis, which is, some people refer to it as PrEP, but it is an HIV prevention program. We have the Ryan White grant program where we offer HIV services to individuals diagnosed with HIV, as well as the Virginia MAP or the Medication Assistance Program where we offer medications to individuals who are diagnosed with HIV. And they're able to pick their medications up directly from the health department. And that's for people who are uninsured or underinsured. And then we have disease intervention specialists. These people go out into the community and find people or they receive referrals of people who have been diagnosed with communicable diseases, STIs such as gonorrhea, chlamydia, HIV, and syphilis. They make sure that they have a linkage to care, bring them back into the health department, make sure that they're getting treatment, and most important, education. And the education is a big part of what we do. And like Ms. Sylvia said, we also refer out to other community organizations, services that our clients may need. We do walk-ins and appointments for all of our services with the exception of our travel immunizations. Those are by appointment only. And information regarding walk-ins and how to make appointments can be found on the Portsmouth Health Department webpage under clinical services. Thank you.
Thank you, Ebony. Again, a plethora of services that are available. It's amazing what gets done at the health department. So thank you for your services. Next, we will have Ms. Sandra Johnson, who is the business manager. She handles all of the finances for the health department.
Thank you, Ms. Avanti. As I sit here and I'm listening to all of our great panel members, I'm just thankful that we have this opportunity to share our story and to really talk about the great services that we offer at the health department. And we all share that passion about what we do and the understanding that public health is about service. and that we are here to serve. And I've heard from each person that's spoken that they're doing just that, and our departments are doing that, just that. We're serving our community. And one of the things, so our business services are comprised of our vital records office, is comprised of procurement, and also administrative clinical support and finance. And I just want to take a few moments just to talk about that finance piece, because it really is a partnership. And I like what Avanti said earlier. She said it takes a village. And it certainly takes a village in terms of providing resources to make sure that we're here. We're here to serve our community. And our finances are really comprised of and is included in terms of a collaborative effort. So I'm just going to talk for just a few minutes about percentages in terms of our FY22 budget. So in terms of the health department, what does it take? It takes human resources and it takes financial resources. And so 40% of the funding for the health departments comes from our state. It's General Assembly funded. And then 35% comes from the city of Portsmouth. They fund 35% of our budget so that we're here to serve, make sure that we stay here to serve. And then we actually have 20% that's through grants. Some of the programs that we've talked about today come through our grant funding sources. And then 5% actually comes from revenue that we generated at the health department. And what does that look like? That looks like clinical services, that because we take insurance. Some people may not be aware that if you have private insurance, you can still have your services that we offer at the health department, and we will file your insurance for you. It also comes from our vital records. You come in, you would need a marriage certificate, a death certificate, or a birth certificate. We provide those services. Also comes from our environmental health services. So all of those components comprise our financial resources to make sure that we are here and that we are here for our community and we're here to serve. And I'd like to end it with that, to understand that I take my role very seriously with the financial piece of this, and that we ensure as a health department that we are good stewards of those financial resources that we have. And then at the end of the fiscal year, any unspent resources are either returned to our state or it's either returned to our locality. And in most cases, it's returned to both, any unspent resources. And so those are my updates, and I'm happy to take any questions.
Thank you very much. My name is Tom Chamberlain. I work with JR, and I'm with EdLogix, and we're working closely with the city of Portsmouth with Healthier 757. And I just wanted to make a few comments, Sandra, on the business case. Like you said, it takes a village, and we're just so excited to be here today to hear about all these services. And we've heard education, and Shannon Glover at the State of the City talked about it's all about engagement. So we have so many great resources, and oftentimes they're not familiar with them or they're not really engaged with them. So the more we can do as an organization, collectively working as partners, is try to get the word out to make all these great resources that Joanna, you talked about the baby care, and safety is a big issue. You talked about car seat safety, but poisons and burns and all the accidents that happen to little kids. So there's so much that we can do. And on the platform that the city of Portsmouth really took the bull by the horns and really took this and put it out into the community. But rewardsforhealthyliving.com is the site that's available to all the citizens, and there's so much there. And we've worked closely with yourself and other people to make this information easy to understand and make it fun and engaging, because learning has to be what's in it for them. It has to be incentives. So we have incentives and information that takes sexually transmitted disease information, safety information, chronic conditions, and really getting at the health disparities that Portsmouth has its fair share of health disparities in the minority population and in those cities that have underserved communities. So I just applaud you, and we're really glad to be here to hear about all these great services. I didn't realize how many services are available and how they're funded. And we're just happy to be part of Healthy Portsmouth. And New Year was the campaign that Portsmouth put out. And as JR said, we want to make Portsmouth the healthiest city, not only in Hampton Roads, but one of the most healthy cities in the nation. So it takes a village, and we're happy to be part of that. But thank you very much. I just wanted to make sure that everyone understands we have these services through Portsmouth available to everyone.
Thank you, and we look forward to sharing those services. We shared at the beginning of the year with the kickoff with Healthy Portsmouth, but we look forward to doing more. Thank you, Ms. Johnson. And we also have Ms. Samara Chapman, who is our emergency coordinator, who was the glue to COVID, one of the pieces of glue. It was a team effort, but Samara led the efforts with the vaccine clinics. Thanks.
Good evening, everyone. My name is Samara Chapman. I'm the local health emergency coordinator for Portsmouth Health Department. It's an honor to be here and be up here with my co-workers and, like Ms. Avanti said, with an awesome team. A lot of people have COVID at the forefront now when they think about emergencies, but my role in the health department is to coordinate, as my title says, efforts and jurisdictions and partnerships, whether at the state level, the local level, the city level, so that we're adapt to respond to all types of emergencies. COVID, biological and radiological attacks, God forbid, any type of natural disaster. We're about to be in hurricane season. We're about to be on the forefront of a lot of things that we've been blessed to not deal with simultaneously since COVID has been upon us. So my job is to make sure that we are the most prepared health department, the most prepared city in the Commonwealth, and make sure that, God forbid, if those disasters happen, that there is minimal effect and minimal damage and minimal loss of life. Also, part of my job is to be the coordinator for our MRC volunteers, our Medical Reserve Corps. Many people do not know this, but in COVID alone, our MRC volunteers saved us almost $10 million in workforce money that would have been spent had we hired someone else. Portsmouth has almost 250 volunteers as part of our Medical Reserve Corps, and they have been awesome. Ebony can attest to this, Miss Sylvia, all of us up here know that our volunteers were literally part of our team from day one, and up as early as we were trying to get a handle on this pandemic. So they have been absolutely awesome, and I'm so proud of the work that we do, and they are definitely an extension of our arm of the work that we do here. Shameless plug, I actually am looking for an MRC coordinator. So for everyone listening to this town hall, if you have someone that you know that is extremely motivated, extremely anxious to get out in the community and help safely, please go to volunteervirginia.org and then look on the Portsmouth Health Department website. That posting will be up sometime this week, and I will be happy to interview you and bring you on the team. Other than that, some of the things that I want to let the community know about, like I said, COVID is still at the forefront. We offer vaccinations every Tuesday from 8 a.m. to 11 a.m. and then from 12:30 to 3 p.m. We do testing every Thursday from 12 p.m. to 3 p.m. And then one of the community events that we have coming up this week is actually this Saturday at the Arabia Temple number 12. From 8 a.m. to noon, and we will have all vaccines available. So if you are out at that community walk, because that's what that event is about, feel free to stop on by and get your COVID vaccine this Saturday. But as far as something during the week, we have every Tuesday and every Thursday available for testing and vaccinations. And one of the things that I'm really proud of is that right now, for the first time ever, we're actually offering vaccination to our pediatric population during school hours. So to all my parents, consent forms were sent home. If you're interested in having your child vaccinated, fill out that consent form, and if you have time, accompany your child during their school hours, and we'll get your child taken care of. We are trying to get back to normal, and I put that in quotes, whatever that new normal looks like. We have to do it together, and we can't do it without you, and we are here to serve, as Ms. Sandra said, and we will only get stronger and better and get past this pandemic. Thank you so much.
Thank you. Thank you. And to add on to what Ms. Chapman stated, we do have positions available. If you check our website, those positions will be listed. You can go to, you could send us an email to vdh.virginia.gov, or you can go to vdh.virginia.gov/Portsmouth, and you can you can go to our website, or give us a call and we can direct you. Now, in addition to the vaccine clinics, we believe in partnering, community partnerships. A lot of times, if there's an event in the community, if we're asked to be there to represent, if you ask for the population health team, the first thing I'm going to do is, would you like to have vaccine available? And we reach out to Ms. Chapman and team, and we see if that's feasible. Sometimes it may not be feasible, but we can have some other options. We believe in partnering together. Together we're better. So there's so many events coming up this summer. You will see us out a lot. Again, we'll be at Emoja. We will be at Juneteenth. We will be at Portsmouth's first Pride event on June 4th. Our calendars are full. We're out during the week. We've been partnering with Portsmouth Redevelopment and Housing for the last couple of weeks, working with the children at the different locations. So it's always fun. We had an event a couple of weeks ago, the Fun Run, with all of the cornstarch. But there were over 1,000 people there, and we were able to offer our services along with maybe 30 other vendors. So together, we can get it done. We know that we can get it done. I will talk a little about population health. Now, the Virginia Department of Health says population health team works with local stakeholders and organizations to determine a community's strengths and needs through community health assessments and to come up with a comprehensive health improvement plan, which is called our CHIP, for the community to use to address the needs. Now, what do? We go out into the community. We talk with our community partners, faith-based organizations, our Healthy Portsmouth partners, anyone who will listen. Everyone has something to offer. Our libraries, we have a health and wellness village in the library where we have our health department information. We listen to our community. My team, my health educator senior and my tobacco cessation coordinator are always in the community. My health educator senior believes in asking the community, what do you want? We're at Portsmouth Redevelopment and Housing. She may not be at that table because she's talking to the residents, finding out what they want. Some of the things that we found out, they're easy things. It doesn't require $1 million grant, a walking club. We were able to apply for the Virginia Walkability Action Institute grant, and we received it. So guess what? We were able to do walking clubs with different neighborhoods. Some of them wanted to have community gardens. Our community team, some of their representatives worked with some of the youth at the apartment complexes and started community gardens. And the youth were involved. That was something that they wanted to do. We can come up with all the ideas based on the numbers that we see and say, this is what you need. If it's not what you want to do, you're not going to do it. So we talk to the community to find out what are their needs, what are their wants, what is going to get you to come out into the community. Sometimes it's live and learn, you learn from your mistakes, but we listen to you. We want your ideas. We base that on what we know that works, what's best for you, what's going to provide the most education, what's going to provide the best outcomes for you for your health. So with that being said, we're looking at doing some more nutrition programs. We're looking to have a breast cancer promotion for Mother's Day. Because of COVID, there were millions of women who did not get their mammograms. Breast cancer happens 365 days a year. With the statistics in Portsmouth, we can't wait until October. This is going to be an ongoing effort. That's just one of the programs. We have so many that will be involving the community and after we have our other meetings and our focus groups, but that's the basis right now. I want to say thank you to the City of Portsmouth for allowing the Portsmouth Health Department to use their facility, for offering us resources. I want to thank our audience. I want to thank the community members, the faith-based community who has stood by us for the last 25 months, all of the community members, the Civic League members who have called. When we started 25 months ago, we were getting about 3,000 emails a day. The numbers have shown we have been able to get quite a few people vaccinated. We're still working on that. But now it's more than vaccinations. It's more to getting us healthy, if that's physically or mentally. And we can do it. So with that being said, if there are no other questions, we are going to wrap up our taping. Be sure once you see this live, if you have any questions, feel free to send us your questions and we will respond. And again, on behalf of the Portsmouth Health Department, thank you for your time and have a great evening.